let's dive into Prehab then, and you walk us through what you actually do with your patients to maximize these surgical outcomes, and also what the evidence behind that is. We are what we eat, so maybe we start with nutrition, right? When I was looking through your content, a few nutrition-focused interventions usually come up repeatedly. One is protein intake, another one is collagen supplementation and the rationale behind it, if there is any. The third would be GLP-1 and GIP agonists, and the fourth is the recovery drinks. Of all the topics, I probably emphasize protein the most when I work with people. And from the perspective of surgeon and as a physician deeply interested in prehabilitation, why is protein so central, and why should it matter so much for patients preparing for surgery?
It really impacts so many aspects of both recovery, so wound healing, things like that, but also your functional recovery and how you feel after surgery. And it does go hand in hand with those GLP-1 medications because those medications tend to have patients eating less protein. We often, as surgeons, forget that surgery is a catabolic event, meaning regardless of what surgery you have, small to big, your body has to break down your muscle protein because those are the building blocks that allows your body to heal. And you need more than you can eat, so it's going to break down your protein. So the more you can do ahead of surgery to increase your reserve, bump up your protein stores, that dip is going to be less substantial. And muscle is so important for just beyond providing those protein stores. It impacts your blood glucose. Decreased muscle, you're going to have increased blood sugar, which is bad for healing. And also, your surgeon's going to tell you, don't exercise for 4 weeks. Take it easy. So now you have another dip in your protein stores, which can make it really hard to get back to your baseline activities, whatever that was, even if it was low to begin with. So anything you can do before surgery to increase your muscle mass and then to support your body as it's digging into your muscles by giving it extra protein orally through your diet is all going to lead to a faster functional recovery and a decreased hit to your muscle.
Yeah, I would agree to that. And I also feel that if we focus thoroughly on providing protein in adequate quantities post-operatively, we then make the body well less looking into those muscle tissues as the protein store, because that's not their primary meaning and not their primary message. It is to serve our functional, our activity, our metabolic state, but not to serve as the reservoir for amino acids. If we tap into this more deeply, based on the current evidence, what protein intake range seems to be optimal for preparing our patients for surgery and supporting their post-op healing?
Oh, that's such a controversial question. The RDA right now for protein intake is 0.8 grams per kilogram of ideal body weight, which is not that much. It ends up being somewhere around 70 grams of protein. Pretty much everyone who researches protein understands that that's not enough. That's not enough even to support overall health and wellness, let alone your body recovering from this massive catabolic insult. So I recommend to my patients 1.6 to 2, maybe even higher grams per kilogram of ideal weight, which is a lot of protein. And if you've ever tracked your macros before, if you haven't, you should. It's interesting. It is hard to get to 120, 150 grams of protein, especially to your point, after surgery. Anyone who's ever rounded on patients after surgery, they're not eating a steak. They're having a donut or a pastry or a latte that someone brought them from the coffee shop. So they're filling up on non-nutrient dense foods that makes it hard to reach that really high protein goal.
Yeah, I think the issue is not only in getting that amount of protein on board, but also getting that correctly spread across the meals of the day, because we can't just dunk in 120 grams and
Right.
hope that's going to work for the whole 24 hours as amino acids is supply. I also would like to add my own perspective, echoing what you've just mentioned about the 0.8 grams. So this commonly cited baseline target was never designed to optimize performance or lean mass and to ensure we're thriving. It's essentially a bare minimum to meet the needs of healthy adults without factoring in the activity or growth and building mass. In contrast, when the goal is preserving or let alone building lean mass, particularly alongside resistance training, we now have completely different evidence. And I totally would agree with 1.6 and kind of north of that grams per kilo per day as the appropriate target. Now, in certain populations, particularly in older adults, I think when anabolic resistance becomes more of an issue, we can even be looking at the 2.2 grams per kilo or even more. Historically, there was this concern that high protein intake increases renal solute load, so causes glomerular damage, and then subsequently we get into kidney failure. But the evidence to date shows that in healthy adults without pre-existing kidney disease, this is not an issue. Certainly, this situation is different in adults with chronic kidney disease because then we need to carefully balance their protein intake and individualize that towards their risks of sarcopenia or adverse renal outcomes. So yeah, I completely agree with that. And protein matters not just for day-to-day life, but also to support our perioperative period. Now, on this note, what proportion of your patients come in aware of how much protein they need to get, and how many of them have been tracking protein and maybe tracking overall nutrition?
One ever? I mean, no one. It's
So
funny
just one
because,
patient for the whole career.
yeah. Yeah, I mean,
Okay.
I can think of her, she's such a model patient to me because she was a marathon runner. She was so motivated to get back to her activities after surgery. We did a huge surgery on her for breast reconstruction, and she had the fastest recovery I've ever seen. But most patients, we forget when we're in healthcare what most people understand about things like nutrition. Most people have no idea how much protein they're eating on a daily basis. And I'll tell you, even when I give this lecture to surgeons, even when I give grand rounds and invited lectures, I ask the audience, like, how many of you have any idea how much protein you're eating on an average day? And there's like the one or two that raise their hand, but it's almost no one. So
I was
most
about
people
to
have
say
no
that.
idea.
Yeah, I was about to say that many doctors have no idea neither about what they take in per day, nor about how much it should be to then recommend it didactically.
Right.
Now, for all people who don't see the reason to track calories or macros closely in a detailed way, do you think it still makes sense to be intentional about protein? Essentially, to define your meal structure around the protein quantity they need to get in, and make sure that it can be actually quite something as boring as eating all the same stuff every day, but as soon as you get to that target right without too much of a hassle of pursuing variety.
Absolutely. It's hard to track your macros. It's a lot of work. And so what I recommend to my patients, unless they're very interested in getting into the weeds and really tracking their data, I just tell them to add 1 or 2 protein shakes a day. I understand that processed protein is not the best option. I would love for them to have all whole foods, but it's not always an option. It's not always easy. But there have been studies showing in patients, regardless of baseline protein intake, if you just add that supplemental 40 to 80 grams of protein a day, which is a lot, it decreases your wound healing complications. And that's easy. You don't have to think about it. Have a protein shake in the morning, have one before you go to bed. You're going to fill up on the good stuff, and then you don't have to worry about doing all the math.
Yeah, amazingly, the 40 to 80 grams of supplementation in addition is usually more than people actually get in per day. So we're talking about radically changing their protein intake. Right, I think we're all on the same page with protein, and hopefully our viewers and listeners will join in. And now let's talk about collagen. Collagen is often marketed as essential for connective tissue health, yet you have been quite skeptical about its real-world value. Is that skepticism driven more by its poor amino acid profile or by the lack of strong outcome data despite plausible mechanisms, or both?
Both. I try to make as many recommendations as I give to my patients and incorporate into my own life based on science. Bottom line, collagen is certainly not going to hurt. It's also not terribly expensive. But what I base my recommendation of kind of avoiding it is, to your point, it's an incomplete amino acid. What that means is it's not providing all of the necessary building blocks for protein synthesis the same way that an animal-based product would. There are studies showing that supplemental collagen can improve things like skin health, even joint health. So there is that that data. But what I always come back to is there's never been a study that I can find, and I've even asked on my social media page, showing that collagen, supplemental collagen, either outperforms a complete protein or is beneficial once you're meeting your protein goal. So the little icing on the top, does that make a difference? And the other thing is that when you think about an animal protein like meat, it has leucine, which is an amino acid, but also directly stimulates muscle growth. So it's also a signaling molecule. That's never been shown for collagen. And so people will say, well, if you eat more collagen, you'll make more collagen. That's not backed in science. There was just a cell culture study that was released this year showing that if you took human cells and added the amino acids of collagen, they had more gene synthesis that would lead to collagen development. So the conclusion of that article was maybe there is some signaling. If that turns out to be true in humans, then I would recommend collagen because that's directly stimulating collagen synthesis, even if it's an incomplete amino acid. We just don't have that data yet. So I think bottom line, it's not going to hurt. If you have endless money and want to spend it on collagen, if you take it and feel like it makes your skin glow, go for it. But I am always about prioritizing what's going to be the biggest bang for people's buck.
Yeah, so not the great return on investment with collagen. I'd like to share my lens, essentially how I was shifting opinion about collagen quite a few times. Initially, I was fairly dismissive. I also saw that as not a great quality protein that gets broken down to amino acids with the body directing those as needed. So didn't see much point in supplementing it or advising it. And then I came across data showing that collagen ingestion isn't entirely equivalent to generic protein intake, that it absorbs as D and tripeptides, and also that there are pro-collagen fragments that appear in the circulation after ingestion, which kind of makes the mechanism biologically plausible. But when we look at the real outcomes, despite this mechanistic plausibility, we don't seem to have robust clinical data showing meaningful improvement in connective tissue recovery of function. So hoping to get better muscle gains from that? Certainly not. Maybe we can be thinking about joint health, about skin health, subcutaneous tissue, and certainly not a case for the muscle. This clip is from an episode of the Sokolov MD podcast featuring Dr. Rebecca Knackstedt, where we discuss the role of prehabilitation in maximizing surgical outcomes. You can find the full episode by following the link in the description.